የጠበቀን የጤና አገልግሎት እዩ ለዜጎቻችን እኩል ተዳርሶ ማየት ትቷል። ሕዝቡን ከበሽታ ካደጋ ከሱስ መዘዝ ሊታደገው ስልቱን መከላከልና ቁጥጥር ላይ ነው ያረገው። የኛ 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 ማህበር የኛ 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 ማህበር አባላቱን በስልጠና ያበቃ እያተጋ ለጤና አገልግሎት ጥራት ማህበራችን ከፍሏል ዋጋ። የተፈጥሮ ሚዛን ለዛ ይወረሳ ይዛባ ማህበራችን ድምፅ ያሰማል በአገር ባጉር ባለማንባ በመረጃና ማስረጃ በጥናትና ምርምር አበልጽጎ ምክር ይሰጣል የፖሊሲም ድጋፍ ጭምር። ጤና አየሩ ጤና አፈሩ ጤና ሰው ጤና እስካልሆነ የለምና ልማትና ብልጽግና ይቀጥላል የኛ ማህበር ሕዝባችንን ማስተባበር አገራችን በእኛ ማበር ትሆናለች ያለም ጀንበር። ይቀጥላል የኛ ማህበር ሕዝባችንን ማስተባበር አገራችን በእኛ ማበር ትሆናለች የጤና ጀንበር። የኛ 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 ማህበር የኛ 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 ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር። የኛ 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 ማህበር የኛ 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 ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር ከመነሻው ሩቅ አልሞ ነበር እያሰፋ የስኬቱን ድንበር ዛሬ አፍሪካ ዛሬ ዓለም ሆኗል የጤና ጀንበር በአፍሪካ ዛሬ በዓለም ይዟል የሙያ ወንበር። ደረጃውን የጠበቀን የጤና አገልግሎት እዩ ለዜጎቻችን እኩል ተዳርሶ ማየት ይህ አንጋፋ ማህበራችን ሩብ ምዕተ ዓመት አልፎታል። ከየሙያ ዘርፉ አካቶ አጋሮቹን አበርክቷል። ሕዝቡን ከበሽታ ካደጋ ከሱስ መዘዝ ሊታደገው ስልቱን መከላከልና ቁጥጥር ላይ ነው ያረገው። የኛ 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 ማህበር የኛ 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 ማህበር አባላቱን በስልጠና ያበቃ እያተጋ ለጤና አገልግሎት ጥራት ማህበራችን ከፍሏል ዋጋ። የተፈጥሮ ሚዛን ለዛ ይወረሳ ይዛባ ማህበራችን ድምፅ ያሰማል በአገር ባጉር ባለማንባ በመረጃና ማስረጃ በጥናትና ምርምር ጽፎ ምክር ይሰጣል የፖሊሲም ድጋፍ ጭምር። ጤና አየሩ ጤና አፈሩ ጤና ሰው ጤና እስካልሆነ የለምና ልማትና ብልጽግና ይቀጥላል የኛ ማህበር ሕዝባችን ሕዝባችንን ማስተባበር ሀገራችን በእኛ ማበር ትሆናለች ዓለም ጀንበር ይቀጥላል የእኛ ማህበር ሕዝባችንን ማስተባበር ሀገራችን በእኛ ማበር ትሆናለች የጤና ጀንበር የኛ 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 ማህበር የኛ 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 ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር ከመነሻው ሩቅ አልመው ነበር እያሰፋ የስኬቱን ድንበር ዛሬ አፍሪካ ዛሬ ዓለም ሆኗል የጤና ጀንበር በአፍሪካ ዛሬ በዓለም ይዟል የሙያ ወንበር ደረጃውን የጠበቀ የጤና አገልግሎት ልዩ ለዜጎቻችን እኩል ተዳርሶ ማየት
All protocols observed. Ladies and gentlemen, good afternoon to you all. My name is Alamnesh Hailemariam. I'm the Vice President of Ethiopian Public Health Association. My colleague, Professor Afork Mulugeta, member of the Executive Committee of the EPHA, is with me. Both of us serve as Master of Ceremony of the opening event of the Ethiopian Public Health Association 37th annual conference this afternoon. Please allow me to introduce the program of the opening event this afternoon. Program is already placed in your bag. We start by warm welcoming from the EPHA President, followed by keynote addresses from our guests, official opening by the guest of honor of the day, and a colorful annual Public Health Award ceremony will follow. Now, I will call upon Dr. Agonafar Takalin to deliver his welcoming address. Please, Dr. Agonafar.
Thank you, Dr. Alamnesh. His Excellency, Dr. Dereje Duguma, State Minister of Health, the Federal Democratic Republic of Ethiopia, and the guest of honor for today, Mr. Stanley Hitikawa, Chief of Nutrition, UNICEF Ethiopia, Dr. Bion, Health System Policy Advisor, and representing Professor Francis. Professor Michael Asuzu, President, African Federation of Public Health Association, who is on Zoom. Dr. Claudius Kemanya, Chief of Staff and Head of the Executive Office, representing His Excellency, Dr. Jane Kaseya, Director General of African CDC. Dr. Toabech Bishau, Immediate Past Secretary General of African Federation Public Health Association. Members of executives and representatives of the General Assembly, members of the EPHA Executive Committee members, invited guests, and representatives of partner organizations, the media house, all protocol observed, ladies and gentlemen. First of all, and may I kindly ask you all to stand up and hold a moment of silence in respect of two issues. One, to the late members of EPHA since our 36th annual conference, namely Dr. Masfin Adise, Mr. Mabratu Abai, Dr. Ishetu Girma, Dr. Andreas Marcos, Antanane Korra, and the second issue is for our people who passed away from Gamo Zone, 3 districts, due to the landslide crisis. I thank you all. Excellencies, distinguished guests, EPHA members, ladies and gentlemen, I feel today honored and privileged to welcome you all as the official opening of the 37th Annual Conference and General Assembly meeting of the Ethiopian Public Health Association that is taking place every year. Despite several hurdles, mainly bureaucratic and system-related problems, it is our second time to conduct our conference in our own premises, though not yet evenly completed. I ask humbly and kindly your endurance for any inconveniences that will be created as we are still moving forward to finish the construction. Last is the finance needed to finish the construction. With more than 10,000 ever registered members of Ethiopian Public Health Association with diverse backgrounds, the Ethiopian Public Health Association is dedicated to enhancing contributions and substance both at national and global scales. Ethiopian Public Health Association is fulfilling its mission by actively using the power of local data and emerging technologies for universal health coverage. The conference will exhibit moderated panel sessions on the main and the sub-themes of the conference, concurrent sessions of 40 oral and 46 portal presentations, including exhibitions and the General Assembly business meeting. Excellencies, distinguished guests, ladies and gentlemen, the future is bright for our association, having its own property with spacious environment and a developing landscape and a strong system for running its activities more than ever. At this juncture, please allow me to thank the Executive Committee members, the Secretariat and the Building Follow-up Committee, which make the Ethiopian Public Health Association House issue a standing agenda item of the regular Executive Committee meetings, and especially I would like to profoundly thank Dr. Alamnesh Hailemariam, our Master of Ceremony today, and Dr. Unet Gabrahana for their relentless and unreserved follow-up of the building, construction, finishing work, and beyond representing the Executive Committee. As per the Ethiopian Public Health Association's tradition, annual Public Health Award in different categories will also be held this evening to recognize outstanding contributors to the advancement of public health in the country and beyond. Over diverse members at large, young and senior researchers, public health professionals in the academia and the health sector that are spread all over the country are all our prides and believed to serve the basis for EPH strategic existence. On behalf of the Executive Committee and my own, allow me to thank all of our members for their unparalleled and unpaid voluntary contribution to the growth and the strength of our association in particular, and to the advancement of public health in general. It is also my pleasure to let you know that EPHA has continued to meaningfully support and serve the African Federation of Public Health Association by virtue of being a seat of the Secretariat in Addis Ababa City, according to the Constitution of the Federation. In light of this, by default, the President of EPHA is serving as the current Secretary General of African Federation of Public Health Association. Excellencies, distinguished guests, ladies and gentlemen, this is the most time that we need to collaborate more than ever. Despite several unanswered public health agendas in the past few years and an unpredictable future, the globe is now facing a new crisis due to quick and fast geopolitical and policy changes that we are observing. To this end, Ethiopian Public Health Association shall deeply be engaged to resolve this crisis in its scope and resource capabilities in a timely fashion and professional manner. I would also like to humbly and respectfully call upon the Ministry of Health to pursue its efforts in leveraging through empowering the EPHA and other sister professional associations, as this will meaningfully address emerging most. Ministry of Health, a special thanks and appreciation go to members of the Scientific Committee of the 37th EPHA Annual Conference. A special thanks again and appreciations also go to mention all Secretariat staff, supporters of the 37th Annual Conference of the EPHA, especially Commercial Bank of Ethiopia, Arada Branch, Bunna Bank, Awash Bank, and the Nib Bank. And there are many others which I could not list them. I would like to express my best wishes for a most rewarding annual scientific conference. I believe this will contribute to advancement of public health and foster shared understanding as a strategy gateway to the way forward. We will await recommendations coming out of this 37th annual conference, as it will greatly contribute and boost our common goals. I would like to end in providing you information and calling upon you to support the landslide crisis which has taken in Gamo zone. To date, it is reported that in the 3 districts from the Regional Health Bureau, 125 people died, but 85 dead bodies recovered. 10,606 displaced people are recorded, and from a total of almost 2,000 households. Therefore, to render the support, I think it is here that all of you who are attending here, please jot down this account number and forward to Ethiopian Public Health Association whatever you have, not only in cash, even in kind. Thank you for joining us at EPHA House Kabana and your contributions at various capacities. God abundantly bless Ethiopia and its people. I thank you all.
Thank you, Dr. Agunafer, for the welcoming address. Now I would call upon Dr. Bijoy, Health System and Policy Advisor, representing Professor Francis Kosolo, WHO representative to Ethiopia. Please welcome.
Good evening, everyone. This is Dr. Bijoy Nambiar from WHO. Our Professor Dr. Kasolo, WHO representative, sends his regrets he is not able to make here another pressing engagement. So I'm here on his behalf. Your Excellency, Minister of State for Health, Dr. Dereje Duguma, Dr. Tekelin, President of EPHA, Professor Azuzu, President of the Africa Federation for Public Health Agencies, Dr. Kamenga, from a representative of the Africa Union, Africa CDC, development partners, academic, civil society, and community leaders, EPHA executive members, and all protocols observed. Good evening. Let me begin by expressing our sincere condolences to the families affected by the natural calamity in Goma zone in South Ethiopia. WHO has already deployed rapid response teams and emergency supplies to treat more than 16,000 people there. Events such as these highlight the importance of associations such as the Ethiopian Public Health Association. It is indeed a great honor to join you on behalf of Professor Kosolo, WHO representative on Ethiopia, Africa Union, and the UN ECA, and indeed the leadership of our organization at this 37th annual Public Health Conference of the Ethiopian Public Health Association. I congratulate Ethiopian Public Health Association for sustaining this vital platform for scientific dialogue and professional excellence. This year's theme, Harnessing the Power of Local Data and Emerging Technologies for Universal Health Coverage, speaks directly to the aspirations of the Ministry of Health and Ethiopia's health sector, and to the priorities of World Health Organization as well. Local data is the backbone of a resilient health system. It allows us to understand the community needs, identifies inequities, allocates resources, and designs interventions that save lives. Ethiopia has made very strong advances. The health information revolution has strengthened routine data use. The DHIS2, which is a district health information system, has expanded, and digital reporting is improving, and is also improving service visibility. Universities, research institutions, public health institutions, development partners, and the Ministry of Health and its parastatical agencies are generating locally relevant research. These efforts are foundational for Ethiopia's journey for universal health coverage. Yet, to fully unlock this power, we must continue strengthening data quality, completeness, and use at every level, at the Wareda and primary healthcare levels, where universal health coverage is truly realized. Excellencies, ladies and gentlemen, globally, WHO sees unprecedented opportunities arising from emerging technologies. Artificial intelligence, digital health platforms, big data analytics, telemedicine, and real-time surveillance tools. When used responsibly, these innovations support data-driven planning, earlier diagnosis, enhances disease surveillance, improves supply chains, strengthens health worker capacity, and expands the reach to underserved populations. Ethiopia is thus uniquely positioned to benefit from this technology. The work of the Ethiopian Artificial Intelligence Institute, the government's digital transformation agenda, and increasing adoption of digital tools in the health system all demonstrate strong leadership and ambition. Yet, we must ensure that technology mirrors the global principles that it must be ethical, equitable, secure, and people-centered. Allow me to highlight 5 areas where data and technology can accelerate progress towards universal health coverage. Firstly, it is about strengthening primary healthcare with decision support tools and digital job aids. Real-time epidemic intelligence is another area, enabling faster prediction and response to outbreaks. Improving quality of care through standardized digital protocols and analytics. Supporting health workforce with telementorship and digital learning. And ensuring ethics and trust with strong data governance and community engagement. At the heart of each priority is one principle. Technology must serve people, not the other way around. As we embrace innovation and technology, we must remain aware that no community is left behind. Digital transformation must reach rural, pastoralist, and hard-to-reach communities, address gender and disability gaps, and ensure data protection and build trust. The breadth of this conference, spanning artificial intelligence, maternal newborn health, health systems, nutrition, environmental health, and ethics, reflect the multi-sectoral collaboration that WHO also strongly champions. And to you, the researchers, practitioners, policymakers, and students, you are the drivers of this change in the future. WHO remains firmly committed to supporting Ethiopia's digital health transformation, strengthening health information systems, and advancing the national universal healthcare agenda. Let us continue to work together, government, academic partners, and communities, to build a health system that is data-driven, digitally enabled, equitable, and resilient. Thank you, and I wish you all a very productive and inspiring conference. Amasiganalu.
Thank you, Dr. Bijoy. Now I will call upon Professor Michel Asuzu. I think his presentation is virtual, right? Yeah. President, African Federation of Public Health Association, for delivering his keynote speech. Thank you.
አንቺ ዓለም ጀንበር ይቀጥላል የኛ ማህበር ሕዝባችንን ማስተባበር ሀገራችን በእኛ ማበር ትሆናለች የጤና ጀንበር የኛ 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 ማህበር የኛ 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 ማህበር የኢትዮጵያ ጤና አጠባበቅ ማህበር
keynote. Now I would call upon Dr. Claudius Kamenga, Chief of Staff and Head of the Executive Office representing Dr. Jean Kasai, Director General of Africa CDC, to deliver its keynote address. Thank you.
Good evening. Dr. Dereje Duguma, State Minister of Health, Federal Democratic Republic of Ethiopia, Prof. Michael Asuzu, President of the African Federation of Public Health Associations, Dr. Diboy Nambia, Policy Advisor, WHO Ethiopia, representing Prof. Francis Kasolo, WHO representative to Ethiopia, AU and UNECA, distinguished guests, ladies and gentlemen, all protocol observed. My name is Claude Kamenga, Chief of Staff, Africa CDC. It's an honor for me to address the 37th Annual Conference of the Ethiopian Public Health Association on behalf of His Excellency Dr. Jean Kasai, Director General of Africa CDC. I express my sincere appreciation to the organizers for inviting Africa CDC to this important gathering. The presence of so many of you, researchers,